The disease congenital adrenal hyperplasia has been studied for decades, and there's a lot of research that's been done in children. But up until maybe 20 years ago, none of these people survived until adulthood.
My personal connection to CAH is that I was actually diagnosed at 5 years old with late onset CAH. And so I have experienced it all my life. And now also my 4-year-old son has CAH. So you can pretty much say my entire life has been consumed with the CAH condition, and certainly more so now with my son having it as well. He was 1 month old when we found out that he had the condition. And I got a call saying, your son has CAH, you need to be very careful of him, you've got to be in here the next morning. Here I was carrying a 1-month-old baby in my arms. My husband had just left the country, and it was at midnight, and I walked my house crying for about 5 hours thinking, I'm gonna lose my child, I'm gonna lose my child. As a parent, you're just looking and you're just trying to monitor the situation. You're getting lots of blood work. You're monitoring, what his levels are, on a very continuous basis. So you're really heightened. You're very fearful of him getting sick.
And is Clay wearing his emergency bracelet?
He is. You want to show Dr. Thornton your
bracelet? Oh, let's have a look.
We've always told patients with congenital adrenal hyperplasia or any other form of adrenal insufficiency where they can't make cortisol to wear medical alert identification, so that if they have a car accident, a heart attack, that the paramedics can give them cortisol to save their lives, because in that situation, that deficiency can be life-threatening. And I was shocked to find that there are no protocols or necessarily even that cortisol treatment is stocked on these emergency vehicles.
We were actually in Denver at a hotel room, and I was at a conference, and my babysitter had Clay in the room, and she had texted me and called me and said, Clay's thrown up. And at that point, he was really starting to go down fast, so I called 911. And when the medical professionals got there, of course, thank goodness for CARES, they had already educated me enough to tell me that, one, I always need to carry the bag with me, and so I was prepared in that regards. The EMS system cannot legally give him the shot. So here I was in a hotel room with 9 trained professionals around me. None of them can give him the one shot of Solu-Cortef that truly will save his life, and I had to do it. And they were trying to get me on the gurney, and I was saying, I will not get on this gurney. You will not take me out of this room. You will not put me in this ambulance until I give my son a shot. And I did it. With shaking hands. There was a very nice paramedic actually that stood there and said, I can't touch any of your equipment, but I can at least just, talk you through it a little bit. Within about 10-15 minutes, at least I had a child that's eyes weren't rolling back in his head. He was getting a little more color to him. I had a little more movement out of him than I had before he was truly going into his adrenal crisis. Anybody who has CAH and who comes up to some emergency situation, Solu-Cortef, that injection is the absolute key component in order to distinguish between life, disability, and death. This EMS initiative that we are doing, it's nationwide, and literally CARES is leading it, and there's some wonderful people within the organization, and there's a lot of volunteers such as myself trying to get Solu-Cortef on our trucks, and we're going literally state by state trying to get it done.